Yes, very good question on how data, or rather the lack of data, affects both healthcare practices and also healthcare outcomes. Well, data is a critical ingredient for decision-making in health systems, not just in healthcare, but also in all sectors. But unfortunately, health systems are really lagging behind compared to other sectors. And I think there are two challenges. First of all, there are many data available, but these tend to sit, they're not digital, and B, they tend to sit in silos and are not utilized. And B, much of the data are actually not analyzed to provide the necessary insights to identify what the issues are in relation to healthcare processes, but also in relation to health outcomes. For example, it's very difficult to get data on equity of access and equity of outcomes, and better understand who is not able to access the system and why. And so as a result, many policies are developed to target the population as a whole, as opposed to the specific groups where the needs are the greatest. So without data, it's very difficult to change current practices and develop innovations. Data is the critical ingredient. But there are a lot of data. Mm-hmm. As the ancient mariner poem says, water, water everywhere, but not a drop to drink. So we have data, but we're not able to use the data because they're not integrated, they're not linked, they're not made available, and they're not analyzed to inform policymaking and decisions.